So I recently received this comment on one of my videos from somebody who is considering studying dentistry, but the person is asking me if dentistry is a lucrative career choice in Nigeria, considering the fact that there is a low dental awareness. This is not the first time I'm getting that sort of question. I've had people write me emails asking me the same question. In this video, I'm just going to be as frank as I can, right? Of course, it's a very valid question. Wanting to know whether the course you want to study is lucrative is one of the first questions to ask before you venture into any path or any course, considering the fact that dentistry is even a 6 year course. So it makes no sense for you to go on that path only for you to graduate and not have money, especially if money is your primary concern. If you're going to choose a course to study, it's important that you know the financial benefits. Like, is it going to be worthwhile? Is it going to be worth your time? Especially if it's a course that is going to demand a lot from you. So, dentistry, medicine, they are 6 year courses. So, it's important that you know whether these courses are going to be worth your time. Will you be able to take care of your basic needs after you spent a huge chunk of your years in school studying them? Now, of course, we know that there are other factors that can make you spend more than 6 years in school. So you may end up spending 8 years or even more. Let me start by saying that if your primary reason for going into anything medically related is because you want to make a lot of money out of it, then this may be a good time for you to have a rethink, right? Because truth is, this work or this job is more of a vocation. I know I've said it before in one of my videos, and I'm not just saying it for saying sake. I'm saying it because it's the truth. This job is more of a vocation than it is an actual job or an actual career path. I also want to say that if lucrativeness is the reason why you want to go into a medical profession, you may also be disappointed because it's common knowledge that in Nigeria, doctors are not paid so much. They're not paid what they are worth. If you're working in a public institution, you may be 2 weeks into a new month and you haven't even been paid for your previous month that you've worked, right? You're going to have to keep showing up at work. As a dentist, if you go to work and you haven't been paid your salary for the previous month, and then you have an elderly woman who is in excruciating pain because she has a toothache, you're not going to say, go home, they've not paid me. You're not going to do that. Your mind, your conscience, the guilt is going to consume you. You're not going to do that. Also, I mean, if you come to work and you're looking at a little child who is out of school because she has a toothache, you're not going to send her home and say, you know what, they've not paid me, so I'm not going to attend to you. In fact, I've experienced cases where people come and they cannot even as much as get the medications that they need, let alone be able to pay for their treatment. You're not going to send these people home. You're going to still find a way around it. So these are part of the reason this is more of a vocation than it is an actual job. So now if your focus is on how much money you're going to make, you are going to be utterly disappointed. So I'm happy that these people are asking these questions now because it just helps to put the whole thing in perspective, right? You're going to be dealing with human lives. Like, the service you're rendering is an essential service, and it is very, very important. It's not something that is dispensable. Yeah, people need healthcare, people need your services, and regardless of how much you're earning, regardless of how little money you have, or regardless of whatever it is that is going on, you are obliged to render services to these people. And even when you do not want to, you have to. And hopefully you don't ever get to the point where you don't want to, right? But yes, so lucrativeness should not, I mean, if money is your drive, then you have to look elsewhere, maybe go into tech or something like that. And just to give you perspective, there are very few dentists in Nigeria, right? The last time I checked, the ratio of dentists to the population is like 1 to 53,000 something. Like, the ratio is so high as compared to the standard or what is expected, which is 1 is to 5,000. And even in developed countries, have as low as 1 is to 2,000. But then here you have like 1 is to 54,000. So the manpower is so limited, right? The good part of it is that you're not going to be moving around with clear bag looking for a job and all of that. The downside is that even when you get the job, you're going to be overworked, right? And then the remuneration, like, anyway, I don't know what this person means by lucrative, right? The good part is, I'm not going to lie, being in the medical profession, being a dentist, you're not going to die of hunger, right? You're going to be able to put food on your table, you're going to be able to keep your head above water, right? But my emphasis, or part of the reason I'm making this video, is because this person said lucrative, right? The people in medical profession who are breaking even, people who are, you know doing extra, like, very, very well, using societal standards. There are people who have been able to diversify to do other things, maybe to venture into business. So let's say you're a doctor, a medical doctor, you can venture into supplying medical equipment, and by virtue of your job or your career path, it kind of gives you credibility. You already know people who own clinics, and it's easier for your colleagues to do business with you because they know you. And because you have an eye for this equipment and all, it just puts you in a better position, right? You can also start out your own practice as a practice owner, which is more of the business part, right? So, but generally, let's say you're working the normal 9 to 5, you're going to be paid a salary, and that salary is not going to be so much to fund the kind of lifestyle. And I don't know what kind of lifestyle this person expects or this person wants, but it's important I say that. And circling back to my initial point, which is that this career is more of a vocation. I remember when I was doing my house job, there was one on call. Being on call means that you're on standby outside work hours, so that if there is an emergency, there will be somebody to attend to this person, right? So I was on call. So I received a call that I had a patient at the trauma center. On getting there, I met this man, and he was disoriented. In fact, he had to be restrained and all. So I assessed him, and I found out that okay, this guy was a thief, and he was caught and was almost lynched to death before security officers came in and salvaged the situation. So they brought him to the hospital, right? Now, being a thief, it's unlikely any family member will want to come and identify with him. So he was just there all by himself. Nobody even knew his name or anything. So we had to see him, as they can send him for a CT scan and all of that. When the result of the CT scan was out, I remember that day when I went to check the results, the consultant there was screaming. He was like, "Who owns this scan?" Like, I think they used a stone or sticks on his head because they literally shattered his skull, and he had multiple fractured bones on his face. So now he cannot even he cannot do the most basic thing he needs to do, right? He can't get drugs. Even the initial drugs that were written for him were given to him. He didn't have to pay for them, right? We did his treatments. We did a treatment for him, that would allow these bones to heal. And I remember every morning when I go to check up on him in the ward to do his oral toileting and make sure he was okay and taking his medication, I would see food on the side of his table. He had eating rice. And I used to wonder, who gives this man food? Till one day I met one of the patients there, and they were complaining that he doesn't want to eat and all. And I was like, oh my god, people are so compassionate, right? Apart from the fact that we had to like rally around to get medications for him, people were also painstakingly offering him food to eat. I remember the nurses telling me that the last drugs we wrote for him, that they had to get it for him, or that, I mean, of course, he didn't have money, he didn't have family members. So this is just one of so many other cases where you're going to meet people who cannot pay, right? So if you understand that it's a vocation, it makes it a lot easier for you to handle. But if you're focused on how much money you're being paid, then you'll be very disappointed, because I don't think the amount of money that is equivalent to the amount of risk you take by attending to patients. Some of them are very high risk patients. So it's good you put all these things into perspective, because 6 to 8 years of your life is a lot of time to spend studying something that you may not like. So my advice is this: it's very beautiful. I don't have regrets studying dentistry, to be very honest. I enjoy practicing dentistry. I enjoy dentistry, right? And maybe that's part of the reason I can talk about it like this. I enjoy clinical practice. I also wish the pay was better. I also wish the pay was more, but it is what it is at the moment. For somebody who is yet to start, this is what I'm going to advise or suggest. You can find a clinic around you, whether it's a public facility or a private facility, and ask to observe, go into an observership with them. So in that observership, you're just going to be seeing what the procedures are like, seeing what the day-to-day job of a dentist looks like, right? When you observe this thing for quite a while, it's going to dispose you and tell you whether this is something you would want to do for the rest of your life. Is this something that you find interesting? I had people tell me, "Oh, I came to a dental clinic and I was so fascinated. The chairs, you guys have a lot of equipment and all." Yes, we do have a lot of equipment, but of course, you're not going to always be fascinated about those things. By the time you walk in there for quite a while, it becomes really basic to you. So the equipment are not the things that are going to be driving you, right? So it's important that you maybe shadow somebody, just see what goes on in a dental clinic. Then that way you can ask yourself, or you can decide holistically if this is what you want to do, because the journey is long. 6 years is a long time, and it's not just 6 years. It's not like 6 years of ease. You're going to put in so much hard work. It is blood and sweat. And I'm not saying this to scare you. I'm just saying this to dispose you, to make you understand how much work you're going to have to put in, right? But dentistry is a beautiful profession. I honestly do not have regrets going on this path. So many of the doctors you see out there who are living large or doing exceptionally well, there are people who have been able to like diversify, like do other things, right? That can foot their bills. Because I remember I made one video where I was saying that if you're going to solely rely on what you're earning, it's probably going to affect your disposition towards your job. But if you have some other thing that you do, right, that puts food on your table or that augments your income, it's going to help you. Like, you know that this job I'm doing, I'm not doing it for the money. I'm doing it because this is something I like to do, right? It's not ideal, but you have to meet your daily needs, right? So yes, many of these other doctors, you could see people going into tech, going into, they own businesses on the side and all of that, going to real estate. There are just a number of things other people go into because generally speaking, in 9 to 5 job, which is basically what being a doctor involves. Actually, you work more than 9 to 5 because there are days you're going to take calls and be on standby for emergency. But basically relying on a salary, on a monthly salary, may not really do the trick for you. So I'm going to reiterate that if money is the reason you want to go on this path, then you may want to have a rethink. But if you shadow somebody, if you do an observership and you see what being a dentist involves and entails, it will help better dispose you to what the reality is. You can also talk to other dentists. This is my own experience. You can talk to other dentists and hear from them what they have to say to you. So yes, this is about the end of this video. If you have any other question that you think I'll be able to answer, please leave it in the comment section. I'll see you all in my next video. Take care. Bye.